Hi everybody, I'm Jay Wyatt from AudioCodes, and today I'm joined by Ollie Chandler, the Head of IT Technical Services from Milton Keynes University Hospital. Firstly, Ollie, thank you ever so much for taking the time to talk to me today. Perhaps you'd like to just introduce yourself and let us know what you do at the hospital. That'd be great.
Sure. So my name is Ollie. I'm part of the leadership here at Milton Keynes Hospital. I work in the IT department, as I've done for many years within the NHS, and I look after a number of the technical teams that deliver support services and projects for the organisation.
Awesome. I guess to give our viewers a little background and as to what we're talking about today, AudioCodes recently deployed SmartTAP 360, the native team certified call recording and compliance recording solution at Milton Keynes University Hospital. So, Ollie, perhaps you could give our viewers a short kind of description of Milton Keynes University Hospital, for example, the size of the hospital and the number of users and what the solution was for.
Sure. So we are a general hospital, an acute hospital. We support around 5,000 staff from the IT department, and that's across a whole vast number of specialties, different areas of business. Obviously, there's admin side as well as clinician side, and we try to use technology wherever we can to make life easier for staff and ultimately for patients. So we do invest in technology to assist with the delivery of healthcare for the population of Milton Keynes and some of the surrounding areas. So we are a forward-thinking organisation, and we like to be on the cutting edge of technology where we can. Compliance and security is part of that journey, and the ability to record calls is something we've had for a long time with traditional on-prem telephony systems. But as we are moving now into the cloud and into more of a dynamic way of telephony hooked in with Teams, we needed a different solution in order to maintain that same level of compliance and assurance for the business.
Brilliant, thank you. And what was the requirement at Milton Keynes University Hospital, and how did the AudioCodes solution address that requirement?
So the requirement's quite simple. We wanted to be able to record the audio at least for our Teams users. We are moving a number of staff away from traditional on-prem telephony services, and their only phone is becoming Teams. We've done the work to integrate Teams and on-prem telephone system together, and that has meant there's been a bit of a gap with the recording and compliance piece. We were looking for something that was native cloud, that there was no on-prem infrastructure for, something that was easy to deploy from a technical point of view, and that would work well for our users and integrate with the Microsoft stack of technology that we use. We are a big user of the Microsoft Azure cloud service, so we were looking for something that would work within Azure. Didn't necessarily have to be that, but that was the ideal, and that's what we found with the solution for SmartTAP. It was essentially just an add-on for things that we already do in Azure today, and connects easily and seamlessly to the call recording elements that Microsoft provide out of the 365 Teams stack. So for us, it was a very nice fit, both in terms of technology that we use, but also the speed of deployment. And I have to say, in terms of speed of deployment, it's probably one of the quickest, easiest things we've done. One of the things we really liked about it when we came to actually deploy, which we didn't necessarily know when we first looked at this, but most of it is scripted. So deploying this is very, very quick and easy. I think AudioCodes have gone to quite a lot of length to make it quick and easy. And when you can run a script in your Azure tenant that builds all the resources you need, that is probably the ultimate, and something that I think a lot of other vendors should certainly look at adopting, because it makes their life, and certainly my life and the life of my engineers, a lot easier.
That's really, really good to hear. And one of the questions, my next question to you was going to be, what led Milton Keynes University Hospital to select AudioCodes over other vendors and other solutions, which you probably already answered that, but perhaps you could just detail it again for us.
Well, I can expand upon it. So we are already using AudioCodes for some other solutions. So we have AudioCodes handsets, phones,
Okay.
not a huge number, but we have those deployed mostly in community settings. Those are running Teams and are connected into our Teams tenant. And we've been using those as telephones for probably a couple of years now and working really well. When we came to look at technology and solutions to link Teams to our on-prem telephony, we again picked AudioCodes. We found that, so we did a bit of a trial there, and there's quite a lot of the team who've got experience in this area of SBCs and so on. So we looked at a number of vendors, and we picked AudioCodes as a solution provider for that. Again, deployed that technology very quick, very easy. We worked with them with a project manager to put that in. I think we spent about 2 days work on this total. So again, very quick and easy to deploy that with the right expertise, both locally and from AudioCodes. And that was a very nice journey. And within a couple of days, we had integration between two systems. And that opened the door for a lot of possibilities. And we liked the look and feel of both the interface and how things work. We like the way that AudioCodes do business, to be honest. It's very easy to work with AudioCodes. We all have anomalies and niggles as we put systems in and solutions in. And where those happened, which weren't often, we found that we got speedy responses and a solution that said what it was going to do. And I think that's probably the key thing. So it became quite a natural choice to then, when we looked at the need for recording all of those things, and some of those conversations are coming off the back of the AudioCodes SBCs that we have deployed here, it became a very natural fit for both the technology and the service. It's one less supplier to have to work with and worry about. And we're very comfortable with the service we get from AudioCodes as well as the technology that we have. So a natural and easy fit and quite an easy decision for us to make when it came to the recording and compliance piece.
Brilliant, thank you. My next question is really about your kind of the end customer. So the end customer would be obviously your colleagues. What was their experience, during and now that it's been deployed, of using SmartTAP?
So to be honest, it's quite seamless, as call recording I think should be. One of the key things that we liked was the ability to display to people that their calls are being recorded. We want to be as transparent as we can be with these sorts of things. They can sometimes be sensitive for obvious reasons. So the fact that we can display messages within Teams when calls start to let people know that those calls are being recorded was a key thing. People like that feature. It's informative. The way that works is that even if one person in the call has the recording policy, it tells everybody that call's being recorded, whether they're internal or external. So that ticks, not only some legal compliance boxes, but it makes it clear to people that that's what we're doing. So people like that feature. It's very useful. The other thing that we didn't have or don't have with our on-prem recording solutions, and that I haven't seen in some others, is the ability for people to go and access their own recordings and get that information. We have integrated that with Azure AD, so to sign into that site to get that is simple and easy. There's no additional usernames and passwords. That's a huge plus for us. We try and integrate security wherever we can. And that makes life easy. So people can go and get their own recordings by themselves from a website that's hosted. They can do that from anywhere they are in the world. And that level of, I think, transparency as well as accessibility are two features that for us really make that solution work and have kept our staff happy and made them happier with the solution that we have now got for Teams. So yeah, thumbs up for that.
So that's really interesting, and I guess it makes them feel less less spied upon and more actually part of the or involved with the process. And like you say, transparency, they're able to get their own recordings.
Yeah, there are. And there's different reasons that people, that we need to record things, and there's different reasons as to why people need to access those. Some people have it as more of a notes thing, and I've used that in the past where we've said we're going to do something and can't think what that thing is. So you can quickly go back and listen to what was said and agreed. That's actually, for me personally, the biggest use case and very handy. Obviously, there are some times where there are difficult conversations that happen with members of the public and other internal staff, and having that transparency and that accessibility, I think, makes life a lot easier when dealing with sometimes some quite difficult and awkward situations.
Brilliant. I guess this is the $1 million question, Ollie. Would you recommend AudioCodes to other companies, to other NHS trusts?
Yes, that's a very short answer, an easy one. Yes, absolutely. I'd recommend the phone handsets. They're decent pieces of kit. They work well. The SBCs that we have, I've been faultless so far. We have a HA deployment of those, so 2 of those physical appliances on premise. They work well. It's very easy to configure them. Everything is laid out in a web-based UI. There's a lot of settings and there is complexity, but of all of the SBCs I've seen and used, I would certainly say that one stands out. And the call recording, I guess in terms of deployment, it's just so easy to do that I think anyone else would be hard pressed to deploy something so quickly and easily. So I think for the NHS as a whole, if people are interested and need call recording, I think, and you're in the cloud and you're using Teams, for me, it's a natural fit. So absolutely, yes.
Brilliant. Thank you. So once again, thank you, Ollie, for your time today. Appreciate that, everything you've said and the information that you've given. If you'd like to view more AudioCodes videos, head over to the AudioCodes channel on YouTube, or alternatively over to the audiocodes.com/library, and you'll find a whole plethora of videos there. If you'd like to know more about Milton Keynes University Hospital, then head over to mkuh.nhs.uk, and I'll say that again, it's www.mkuh.nhs.uk, and you'll find more information. Thank you for viewing.